So good afternoon, everyone. My name is Kendra Julian. I am the Adolescent Immunization Specialist at the Partnership for Maternal and Child Health. I would like to thank you all for joining the webinar today. So today we have 5 panelists that will give a brief presentation and share resources about the importance of flu and the vaccine. There will be time at the end of the webinar to ask questions that you may have for the panelists. Also, for those who stay for the entire webinar, will be entered into a raffle. So thank you again for joining, and I hope you find the information that is being provided useful. So first, I would like to introduce Emily Haynes. Emily is the Director of Public Health Initiatives at the Partnership. She will be sharing information about flu in New Jersey. So Emily, please take it away.
Thank you, Kendra. On behalf of the Partnership for Maternal and Child Health of Northern New Jersey and the Essex Metro Immunization Coalition, I'd like to welcome everyone to today's Flu Resource Fair. And thank you for joining us to learn more about flu. I'd like to also extend a thank you to all of our panelists for offering their time today to give their expertise around flu vaccination and to tell us about where we can go to get a flu vaccine this fall and throughout flu season. So just a quick introduction to the purpose of today's resource fair and how we brought everyone together. The coronavirus pandemic has had a tremendous impact in New Jersey. And one of the areas that we see that impact is in routine immunizations for children and adults. So I just want to emphasize that it's really important to stay up to date with your routine immunizations for yourself and your child. And also this year, it's more important than ever to get a flu vaccine. Flu vaccine is already available in New Jersey. And flu season can start as early as October. So it's really important to learn about flu early and also to make plans to get your vaccine. And with the coronavirus pandemic, we want to try to avoid unnecessary hospitalizations and hospital stays and to avoid burdening our health systems. And I just wanted to share this fact with everyone that a 2018 study showed that getting your flu vaccine for adults reduced the risk of being admitted to an ICU with flu by 82%. That is really significant. And so one of the best things you can do to avoid unnecessary hospitalizations this fall and flu season is by getting your flu vaccine. Another thing that's really important as we make plans for our children to attend school, whether it's in person, remotely, or some type of hybrid this flu season, is to make sure that they stay up to date on their routine immunizations and to get them a flu vaccine, because they can be still exposed to flu even when they're not attending school in person. And getting a flu vaccine reduces a child's risk of dying from flu by 65% for healthy children and by 51% for children with underlying health conditions. So getting a flu vaccine protects yourself, your family, and your community. The partnership will also be launching a statewide flu campaign this flu season to encourage everyone to get their flu vaccine. And you can join us at the New Jersey Influenza Action Group to help spread the word to your contacts, your family members, your friends. And if you're interested in joining that initiative, you can reach us at the partnership to learn more. Thanks so much, Kendra.
Thank you, Emily. All right, so now we're gonna, I'm now gonna introduce our first panelist, Jennifer Smith. Okay, good. So Jennifer Smith is the health educator for the Vaccine Preventable Disease Program at the New Jersey Department of Health. In this role, Ms. Smith selects and develops appropriate immunization educational materials for use by the public and healthcare providers, facilitate meetings and special events to increase immunization awareness, and serves as the VP-DP liaison with Department's Office of Communications. Ms. Smith has vast experience in the field of public health education and communications. She obtained her master's in public health with an emphasis on health education and behavioral science from Rutgers of Public Health and is a certified health education specialist. Most recently, she received the Louise Chutt Award for Program Excellence from the New Jersey Society of Public Health Education for work on childhood immunization campaign. Ms. Smith values lifelong learning and having the opportunity to collaborate with others on important health initiatives. Jennifer will give an overview of the importance of flu prevention and share resources.
Thank you, Kendra, for that lovely introduction. So the title of my presentation again is What's New with Flu, and it's information for the 2020/2021 flu season. Next slide, please. So we're going to start out by talking about influenza. I'm sure you heard a lot about influenza. So just a brief background. Influenza, or more commonly known as the flu, is a highly contagious or easily spread respiratory illness that's caused by influenza viruses that infect the nose, the throat, and the lungs. Symptoms can include coughing, sneezing, headaches, body aches, and fever. And the flu can be very serious, even for healthy people. And that's something I want to get across today, that, even healthy people can get very sick from the flu. Next slide. So now we're going to discuss how do people actually get sick with the flu. Well, respiratory droplets are generated by a person when they cough or sneeze, or even when they talk. Those droplets can be propelled into the air, and they can go into another person's eyes, nose, or mouth over short distances, probably 3 to 6 feet or so. And then also contact with the flu virus can occur through direct bodily contact, such through kissing or touching something with the virus on it, and then just like shaking somebody's hands, and then maybe that person is sick with the flu, and then you touch your own mouth, nose, or eyes. That is one way that it could be spread. Also, germs can be passed along when you touch the mucus droplets from someone else on a surface like a desk, and then you touch your own eyes, nose, or mouth before you get a chance to wash your hands. The important thing is that viruses like the flu can actually live on surfaces for 2 hours or longer. So that's why it's so important to try to clean commonly used surfaces to try to prevent that spread. And of course, to wash your hands pretty quickly and to social distance. Remember that the flu is very contagious, like I stated. So most healthy adults are able to infect others beginning 1 day before symptoms even appear, and up to 5 to 7 days after becoming sick. Now, children, they may be able to pass the virus on for even longer than 7 days. So just some things to keep in mind. Again, it is very contagious. Next slide, please. So what can happen if you do get sick with the flu, or what are the consequences? Well, most people who get the flu will recover in a few days, or perhaps maybe like less than 2 weeks. However, some people may develop serious complications, such as, it could be life-threatening even. Pneumonia, which is a serious lung infection, could occur. Bronchitis, sinus and ear infections are all examples of some complications. The flu can even make chronic health conditions worse. So, for example, if you have asthma, you may experience more frequent asthma attacks if you become sick with the flu. And people who have like congestive heart failure may experience worsening of that condition if they do get sick with the flu. I want to also point out that even if you have a mild case of the flu, you can still miss out on a lot. You could still miss out on weeks of school, work, activities, and fun times with friends and family. So that's another important consequence to consider. Next slide, please. So who is at high risk of flu-related complications? So although the Centers for Disease Control and Prevention, or the CDC, they recommend that everyone 6 months of age and older receive a yearly flu vaccine. But there are certain populations who are especially vulnerable. And this includes children who are younger than age 5, especially those who are younger than 2 years of age, adults 65 years and older, pregnant women, and women who are, about up to 2 weeks postpartum, residents of nursing homes and long-term care facilities because they're already probably immunocompromised. American Indians and Alaskan Natives are also a high-risk group. And as I mentioned before, people with certain medical conditions such as asthma, heart disease, diabetes, and so forth. Next slide, please. So how can you protect yourself? Well, the first and most important step in protecting yourself against flu is to receive your yearly flu vaccine. Preferably, you should get it before the end of October. And to help remember this, you can use the slogan, "Be seen by Halloween." So hopefully that will help you to remember. Keep in mind that it does take 2 weeks for the vaccine for the antibodies or the protective proteins to develop in their body. So it takes 2 weeks in order for you to get that, to provide that protection against the flu virus infection. That's why it's best to get vaccinated before the virus starts to spread in your community. Getting vaccinated later, however, can still be beneficial, and vaccination should continue to be offered throughout the flu season, even into January or later, because the flu season can even last as late as May. I do want to caution, though, and this is something that the CDC has mentioned this year, that getting vaccinated early, such as July or August, it's likely to be associated with reduced protection against the flu infection later in the flu season, particularly among older adults. So that's something to keep in mind. So I guess, the preferred time is September, October to get that vaccine. So remember, be seen by Halloween. In addition, I know this is a long slide, but I wanted to mention some other things here. I stated that everyone 6 months of age and older is recommended to receive a yearly flu vaccine. I also want to point out there are many flu vaccines available, and healthcare providers may choose to administer any licensed age-appropriate flu vaccine. There's no preference over any one vaccine over another. Some vaccines are not recommended in some situations and for people with certain health conditions. For example, pregnant women should not be receiving the live attenuated vaccine or the nasal spray vaccine. That's just an example, but they should be receiving the flu shot. So your doctor would know best about which vaccines are suitable for you. Also keep in mind that some people should not receive the flu vaccine at all. This is uncommon, but there are certain folks who cannot receive the vaccine either because they had a severe allergic reaction to a previous dose or a severe allergic reaction to a component of the vaccine. And I have some information on this slide here about who should and should not get a flu vaccine. So please visit that resource as well. And you can also protect yourself, in addition to getting the vaccine, you can also protect yourself by practicing healthy behaviors such as washing your hands frequently, covering coughs and sneezes, and staying home when you are sick, except of course to seek medical care. Finally, I want to note the last item on this slide is taking antiviral medications may be an option for you. Now, these medications are started within 2 days of becoming sick. The antiviral drugs, what they can do is they can lessen the fever and the flu symptoms, and they can shorten the time that you were sick. Early treatment with antiviral drugs can mean having a milder illness instead of a more severe illness, and it can reduce hospital stays. Again, these are prescription medications. and they're usually recommended for those who are at high risk of suffering from severe consequences if they get sick with the flu. Next slide, please. So what are the benefits of flu vaccination? Well, approximately 40% of the US population chose to get a flu vaccine during the 17-18 flu season. Now, that's not, we hope to have greater flu vaccination coverage than that, but even with 40%, we saw some great benefits of flu vaccination. With those who got vaccinated, because of those who got vaccinated, we saw 6.2 million flu illnesses were prevented because of the benefits of vaccines. Again, this prevented an estimated 6.2 million flu illnesses, 91,000 flu hospitalizations, and 5,700 flu deaths. So imagine what we can accomplish and all the benefits we could reap just by getting more people vaccinated. That's just with 40% flu coverage. So we want to kind of boost that to have even more benefits and to see those benefits. Next slide, please. This is a common question. Is the flu vaccine safe? And the answer is yes. Hundreds of millions of Americans have safely received the flu vaccine over the past 50 years, and there has been extensive research supporting the safety of flu vaccines. The most common side effects are soreness and redness or tenderness where the flu shot was given, headache, fever, nausea, and muscle aches. And I just want to mention that CDC and its partners use multiple systems to monitor the safety of the seasonal flu vaccines even after they are licensed. So it's a continuous occurrence that the safety is monitored even after the vaccine is licensed. Next slide, please. So why is the flu vaccine so important? Well, since Emily kind of touched on this earlier, and I just want to reinforce that message, since COVID-19 will likely be circulating during this year's flu season, so getting a flu vaccine this fall will be more important than ever. Getting the flu vaccine now will not protect against COVID-19. However, the vaccine can reduce flu illnesses and hospitalizations. So this can help to conserve potentially scarce resources during this pandemic. So you want to kind of help and do your part with that. And influenza and COVID-19 share many symptoms. So preventing influenza means fewer people will need to seek medical care and testing for possible COVID-19 or influenza. So again, just keep that in mind about why it's so crucial to receive your vaccine, your flu vaccine this season. Next slide, please. Where can you get vaccinated? Well, to help prepare for the 2020-2021 flu season, through the Department of Health's 317 funded adult immunization program, the department has allocated a larger number of adult flu vaccine doses. So low or no cost flu vaccines will be available through your local health departments, federally qualified health centers or FQHCs, and several nonprofit organizations. And I list the directory to the health departments and the FQHCs on this slide, and be sure to contact them, call ahead, see if there's any procedures in place before you visit, any other directions, and make sure that they have the vaccine in stock and so forth. And through our New Jersey Vaccines for Children program, or our VFC program, the department also ensures that private providers can offer no or low cost for children's flu and other vaccines for those children who are Medicaid eligible, uninsured and underinsured, and American Indian or Alaska Native. So you might want to check with your healthcare provider to see if he or she participates in the VFC program and to see if you are eligible. So again, there's many locations to receive your flu vaccine. Check with your healthcare provider, again, to learn if the vaccine will be available in outdoor setting, or if other precautions are in place to maximize patient safety, such as are there separate times for vaccine visits versus sick visits? Again, we're all about safety here and maximizing that patient safety during the current pandemic. So this slide here is showing some of our New Jersey Department of Health flu resources. On the left-hand side of your screen, you will see our flu basics brochure. And this brochure is exactly as it is described. It's flu basics. It describes what is the flu, what are the symptoms, how can it be prevented, and where can I get additional resources. I want to point out that I have the English version of this showing on this slide, but this brochure is available in 12 other languages. And we do have hard copies at our office, so feel free to contact me. We have them in, Spanish, Portuguese, so many other different languages. So feel free to contact me, and you can visit our website, that link underneath the brochure, to see them electronically. And then on the right-hand side are some of our other flyers. We have Prevent the Spread of Colds and Flu, some tips for that, and Flu in Your Teen, how to know the risks for teens and flu. And again, please check out our website. We have a wealth of resources. An easy way to remember our website, and it's listed there, is nj.gov/health/Fight the Flu New Jersey. We also have, next slide, we also have some campaigns that were going on in New Jersey. We have our New Jersey Influenza Honor Roll, which is a program to recognize institutions that are striving to promote flu awareness and prevention within their communities. I have the website listed underneath that image. And then we have the Flu Challenge, which is to recognize colleges and universities that institute flu campaigns on campus. So feel free to visit those websites to learn more. Next slide. I want to mention that in addition to flu vaccine, I want to stress the importance of all routine immunizations, just as Emily stated. As many of you are probably aware, August is recognized as National Immunization Awareness Month. So let's celebrate those last few days that we have left. And, please visit the CDC. You can visit their website at cdc.gov/vaccines. That'll give you a link to all of their vaccine resources. And use the hashtag #IVAX2Protect to follow immunization related news, related to Immunization Awareness Month. And before I end, I just want to spice things up a little bit. Next slide. I have a trivia question. So in 1948, a retired school teacher was a patient in a San Diego polio ward, and she was surrounded by young children also suffering from polio. So to kind of help cheer them up, she created a simple board game for them to play together. Well, a year later, the toy manufacturer Milton Bradley bought the game from her, and today polio has been nearly eliminated, but this game is still being played in millions of homes around the world. So just take a second and think about what this game could possibly be. Now, I don't have it as a poll. I just want you to think about it out of all the games that are out there. Okay, next slide. That game is Candyland. So next time we're playing Candyland, remember it has you can, think of immunizations and how this game helped to cheer up children who were suffering from polio, and it was able to bring some joy to their lives, and it's able to still bring some joy to our lives nowadays as well. And again, I'm not promoting the game. I just wanted to give you some trivia there to spruce things up a little bit. So next slide. So in summary, flu is a serious disease, but the important point is that it is preventable, and you have the power to protect yourself and others through vaccination. So we may not have a vaccine for COVID-19 yet. However, we do have a vaccine for flu, so take advantage of it. Flu vaccine is especially important this year to help protect your health and to conserve potentially scarce medical resources, especially in light of the pandemic. And also make sure that in addition to flu vaccine that you're up to date on all age-appropriate immunizations, and continue to practice those healthy behaviors, covering coughs and sneezes, maintaining social distancing, washing your hands frequently, and staying home if you're sick, except to seek medical care. Thank you very much for your time and attention. I hope this was helpful to you. And I'll stick around if you have questions towards the end. So thank you very much.
Wonderful. Thank you so much, Jennifer, for such great information and the resources that you provided. So I'm now going to move on to our second panelist. Right. So I'm going to introduce Iris Novus Cooney. She's the Manager of Community Health Education at Horizon Blue Cross Blue Shield of New Jersey. Iris initiated her clinical career in healthcare as a registered dental hygienist in 1998. Iris' experience with patient care fueled her passion for global public health, specific to community health science. She completed her master's in 2011 in healthcare administration, community health science. Iris continued her health services as a clinician and pursued expanding her experience in public health research at NYU School of Medicine, Department of Population and Health. Working at NYU exposed her to a variety of population health research, specifically in community health science. In 2015, Iris joined Horizon Blue Cross Blue Shield Government Program Communication and Public Affairs team as a community health educator, recently promoted to Manager Community Health Education. In this role, Iris' focus has been health education development and promotion initiatives. She also leads the member and community advisory councils with the overarching objectives of establishing and sustaining member and community partners relations, expanding Horizon Blue Cross Blue Shield reach and influence on health and wellness in New Jersey. Iris will talk briefly about insurance and how you can pay for the flu vaccine. Take it away, Iris.
Hi, hello everyone, and thank you for that warm introduction. Thanks again for the partnership to inviting us and participating in this forum. Since the coronavirus pandemic, our efforts have transitioned from field-based health promotion and prevention resource to a virtual space, since we're all homebound and trying to maintain and reduce our risk of unnecessary exposure out in the community. So today I'm going to talk a little bit about some of these efforts in lieu of the pandemic to support not only our members, but the larger community around the 21 counties in the state of New Jersey. Our focus have really been transitioning as a direct contact resource for folks who are either existing Medicaid recipients under Horizon who need ongoing support for disease management during the pandemic, and for the very large number of folks who are currently unemployed, their income has changed and are now eligible for Medicaid coverage since they are no longer employed and covered under their employee-based coverage. Much of our efforts is around educating folks on Medicaid literacy and how to leverage and utilize the health coverage to maintain their health and or help them with disease management. Much of our efforts too are with immunization compliance and well checkups. Many folks are still very reluctant to connect with their doctors. So around our prevention health focus presentations, we emphasize how in spite of the pandemic, disease management and prevention screenings and care do not take a pause. Disease is ongoing and we still need to connect with our medical team or medical home in order to keep us healthy, well-maintained, and also reduce the risk of complications from exposure to conditions like the coronavirus. So I would like to emphasize that as part of this, we really maintain a focus on communicating effectively with your medical team or healthcare providers with the virtual tools allotted to them, either through telemedicine or telehealth. Also utilizing the internal support programs that many HMOs have for disease management and or compliance with like referrals and like specialization needs, and most importantly with vaccinations and immunizations. Many folks, because of the fear of unnecessary exposure or just navigating through technology, the emphasis on our health promotion education has been how to utilize these resources in order to keep themselves healthy, keep themselves compliant with their vaccination or immunizations regimens, and also just overall keeping New Jersey healthy. As part of the resource that we provide is also sharing the information, as many folks are unaware that they may be eligible for Medicaid coverage under NJ Family Care, especially folks who never imagine being unemployed, losing their employee-based coverage. And there has never been a more critical time to ensure healthcare coverage. Right? If you need medical care, you should not have to worry that you are currently uninsured. So I also encourage folks to please connect with us. We have folks waiting on the sidelines to help either by phone or through any type of virtual means that folks are comfortable using to ensure that they are covered, and to connect them to the internal resources in order to help them maintain their health and or help with their disease management. Lastly, I just wanted to highlight that many folks are experiencing the trauma of the pandemic in different ways. There is a great deal of food insecurity that we are experiencing as a society. Nationally, but specific to New Jersey, there are many folks that are experiencing worse food insecurities than before the pandemic. So we have also been committed to connecting folks to outside local resources to ensure food access, health access, and any other resources that they may need at a local level. Our information is in the slide in front of you. I encourage folks to please connect with Kendra, and she'll be happy to connect you to our team. Again, my name is Iris Novascuni. Stay healthy. Please social distance, wash your hands, stay home if you are sick, and please connect with your medical healthcare providers and your medical team to ensure that you stay healthy, your family stays healthy, and that we are promoting, modeling healthy behaviors. Thank you.
Thank you, Iris. Thank you for such great information. Okay. So now that I'm going to move on to our next panelist, Velda Fontmaris. Velda Fontmaris is from the Newark Department of Health. She has spent her life educating staff, parents, and children on optimal health practices in home, school, and in the workplace. She is currently the immunization coordinator for the City of Newark's Department of Health and Community Wellness, ensuring Newark's children are age appropriately vaccinated. She entered the health department with more than 2 decades of successful pediatric health and safety experience and a wealth of vaccine knowledge. She received her graduate education at Capella University in Minneapolis, Minnesota, with a master's in public health, concentrating in social and behavioral health. She also holds a bachelor's degree from Rutgers University, and as a first aid, CPR, AED instructor, and New Jersey child health consultant, she has trained thousands of New Jersey teachers, nurses, parents, EMS, and healthcare workers on a variety of public health, medication, child wellness, and safety issues. So Velda will give information about the School Bus Express program and discuss the extended hours Newark Department of Health is offering.
Thank you, Kendra, and good afternoon. The purpose of the Newark Department of Health and Community Wellness Influenza Program is to ensure that New Jersey mandatory influenza vaccine requirement is adhered to. As we know, it was mandated by the state that children 6 to 59 months of age attending any child care, daycare, preschool, Head Start program on or after September 1st, 2008 had to annually receive at least one dose of the influenza between September 1st and December 31st of each year. People can avoid the flu, and that will help reduce the burden on the U.S. healthcare system already overwhelmed by COVID-19. The program is twofold. We do immunizing on site in an immunization clinic, our FQHC, the pediatric practice and the adult practice, as well as immunizing in the Newark community at daycare, childcare, Head Start, charters, schools, hopefully soon Newark public schools, senior housing complexes, and recreation centers in Newark. Our FQHC is the Mary Eliza Mahoney Healthcare Center located at 394 University Avenue in Newark. We conduct two types of influenza vaccine program. On residents, those that are VFC 317 eligible, we do that in the office at 110 and 394 University Avenue. And those that are administered out in the field. The residents or the parents of the children at the daycare, childcare centers are required to fill out an informed consent. And that has the history in their previous vaccine outcomes so that we can put it into the New Jersey Immunization Information Registry system for their medical providers' records. I'd like to let you know that presently we are doing the School Bus Express program, and the School Bus Express program gets children ready for school. Now, I know that the children are virtually learning, but just because they're virtually learning, we don't want them to fall behind on the age-appropriate vaccines. That program started Monday, and it goes until September 26, 2020. We have extended evening hours on Thursdays and some Saturdays. And the program has been very, very successful in ensuring that children are ready to go to school and ready to learn. The slide that I have that I sent has services that are provided by the Newark Department of Health and Community Wellness and the Mary Eliza Mahoney Health Center. It has all of the essential services that we provide, from animal control, dental services, environmental health, food and drug control, homeless prevention, immunization, pediatric immunization for the adults. And when I say adults, I mean age 19 and older. The lead poison control program, medical services, which are healthcare services for adults, pediatric services, which is pediatric services for the children. I have given you the rodent control number, the Ryan White Clinic, the sexually transmitted disease clinic or STD clinic, social services. I didn't know if I mentioned homeless prevention services, the vital statistics department, walk-in clinic that we have at 140 Bergen Street, and the WIC program, Women, Infants, and Children, that's located here at 110 William Street. I just want to encourage everybody to get their flu shots because, as I said, and as the previous speaker said earlier, that the healthcare system is already overwhelmed with COVID-19, and we don't want anyone to be ill. We want everybody to stay healthy and well. Wash your hands, commit to the social distancing, and be well. Thank you.
Thank you so much, Velda. And that information that Velda mentioned is attached to the webinar, but I can make sure that you all receive the resources that she mentioned today. Okay, so thank you again, Velda, for your information. Okay, so now we're going to move on to our next panelist, Michael Pedro. Michael is the pharmacy manager of Community Walgreens, a specialty pharmacy that focuses on serving patients with high-risk disease states such as HIV, cancer, seizure disorders, and many more. Michael and his team assist in getting medications approved through insurance, locating funding to lower patients' co-payments, and providing clinical consultations on specialty medications. In addition, he still worked with his previous store in Newark to promote immunization and immunization education throughout the area. Michael will share when and where Walgreens Pharmacy will be administering flu shots. Okay. All yours, Michael.
Thank you, Kendra. So as mentioned, my name is Michael Pedro. I'm the pharmacy manager of the specialty Walgreens located on Central Avenue in Newark. Today, I just want to give you guys a little information on the role that Walgreens and your regular traditional pharmacy can play in helping you to get a flu shot for this upcoming season. All of our stores have specially trained pharmacists that can provide the flu shot in addition to other vaccines that you may be eligible for. That's based on your age and your health conditions. No appointments are necessary. You can just walk in as if you're coming to pick up a prescription. And once you fill out the vaccination forms to make sure that you are in fact eligible, you'll then meet with a pharmacist in their private vaccination area shortly thereafter. While we are in the midst of the COVID-19 pandemic, we are taking extra precautions to protect both our team members and our customers by checking temperatures prior to vaccinating patients, in addition to wearing the proper PPE and face shields during the shot itself. We could just go to the next slide, Kendra. All right. So our stores are really here to supplement other healthcare providers and organizations such as doctors, the Department of Health, and assist in protecting as many people as possible from the flu. With a variety of locations within the community, some of them even being open 24 hours, it does make getting a flu shot easy at whatever time works best for you. This season, all of our stores will be carrying the quadrivalent flu shot, which means it does cover 4 types of the virus, in addition to the high-dose flu shot that protects our patients who are 65 and older. Lastly, I just wanted to end my session by reviewing the age requirements necessary to get a flu shot at Walgreens this season. As the season progresses and inventory starts to get lower, we do get a lot of questions in regards to protecting children against the flu. For those patients who are less than 7 years old, you do have to go to your prescriber. From 7 to 11, at the store, we can provide the flu shot as long as we have a prescription from your doctor, in addition to the parent or the guardian being there to sign the vaccination waiver as well. From 12 to 17, we can give the prescription, we can give the vaccination with no prescription, as long as, again, the parent or guardian is there to sign. And lastly, those who are 18 and older can just walk in. There are no additional requirements necessary. It is important to note that although we can vaccinate clients down to 7 years old, some insurance companies do require the patient to be a certain age, which is usually sometimes 18, in order to be covered at the pharmacy. My best recommendation is just go to your pharmacist if you're in the store, see what's necessary with your insurance and your specific age and children, and we can direct you to the right place to go, as well as all the organizations that were mentioned earlier. So if you have any further questions, my contact information was listed on the beginning of the slides. Feel free to send me an email or ask any of the questions at the end of today's session. So thank you so much, and be safe out there.
Thank you so much, Michael. Okay, great. So now we'll be moving into our last panelist for the evening. Dr. Vanagaria is an assistant professor in the Division of Ambulatory Care and Pediatrics for the New Jersey Medical School. She's a part of the pediatric primary care team at the Doctor's Office Center located on 90 Bergen Street in Newark, which is a part of University Hospital. Along with her colleagues, she and her team provides primary care to children and adolescents in the community of Newark. Vaccines are important Vaccines are an important part of any pediatric practice, and as a group, they strongly advocate for all childhood vaccines that are recommended by CDC and AAP. Dr. Vanagaria will share information about flu in pediatric and the importance of the flu vaccine. Okay, doctor, take it away.
Good afternoon, everyone. Thank you, Kendra, for the introduction. Like she mentioned, I'm one of the faculty here at Rutgers Medical School and JMS Newark, and our practice is part of the University Hospital Newark. And yes, we provide all the pediatric care for all the pediatric patients along with my colleagues. So as a pediatrician, I do strongly recommend getting your scheduled vaccines, and more importantly with this season your flu vaccines. Now that we are all dealing with this COVID-19 and the pandemic this year, it's more so important to get your child vaccinated and protected against the influenza, both being respiratory infections. There is no you are likely to get either or even both. COVID-19, as of now, we don't have a way to prevent it, but for influenza, flu, we can prevent easily by just getting your yearly flu shot. So I strongly recommend that. Generally, like in medicine, there is a saying, and I believe in strongly, is prevention is going to be always better than cure. Children are more prone to get infected from flu because they share everything, they play with the other kids. Now that we are going to be talking about opening school with this hybrid culture, some kids will be going to school, some will not, some will be doing the virtual learning, but they are prone to get the infection more than any adult, and they can spread the infection to their family members and others as well. So that's why it's more so important to get them protected with the flu vaccine, with just getting your flu shot. There are very minimal side effects with the flu vaccine. You can just get local tenderness and injection site soreness and maybe mild flu-like illness, but that should not prevent you from getting a flu vaccine. I do get that question a lot from many parents that they can get flu regardless whether they are vaccinated or not. That is true, because how effective the vaccine is going to be, it's hard to tell unless we do the analysis at the end of the year. You can still catch a different strain of a flu virus, and you can get a mild illness from it. But if you are immune with the vaccine beforehand, then your disease is not going to be as serious as you were to otherwise. So getting your child vaccinated definitely prevents inpatient hospitalization and maybe in some cases complications like younger the kid, the risk is more that you are going to get more complication from the flu infection. You can get pneumonia, sometimes encephalitis, viral meningitis, and the sequelae from there. Luckily, we do have like antiviral treatment that we can use against flu, but it's not necessarily that you can prevent the complication if you are to receive the antiviral treatment. You can definitely decrease the infectivity, and also maybe the disease will be milder compared to you not taking medicine, but the long-term consequences and hospitalization and even death cannot be prevented by antiviral medications. Last year, for example, CDC reported there like 187 deaths from just influenza. So influenza is a deadly disease just like the COVID-19. So we can prevent it with just yearly flu shot. I strongly recommend that to all my parents and my patients who are the kids. Anyone who is 6 months and older can receive the flu vaccine. If you are to receive the flu vaccine for the first time, then your child might need a booster shot in like 4 weeks. So just check with your doctor or your healthcare provider and schedule for your flu shot or your yearly physical, and you can do the flu shot at the same time. Many patients ask me, the other question is why I have to get the yearly vaccine, because the way flu vaccine is developed is flu keeps changing its strain year around. So there is a lot of research involved in developing the vaccine. So this year, for example, for year 2021, CDC has decided to have a trivalent vaccine. There is a quadrivalent vaccine, and they are also even introducing live attenuated vaccine, the nasal spray or the nasal shot that you can give your child. They are not recommending, one is better versus other. But for example, if you have a history of severe egg allergy or severe reaction to the vaccine component, which has a egg component in it, you can choose to get the other vaccine, which are cell based. There is no, any egg is used in the manufacture of it. But in terms of effectivity, they are equal. There is not one, better versus other. And lastly, the important question this year is, being this pandemic and COVID-19, should it affect you to get your flu vaccine? No, it should not. Check with your, healthcare facility. For example, in our clinic, we are trying to separate out the visit. As of now, we have started to do extended hours once a week to make sure to catch up with our scheduled vaccines. And in a month or so, when we will start vaccinating for the flu, we are going to try to separate the visits out from the other sick visit and the scheduled well visits to make sure there is not overcrowding in the waiting area, or people who are just here for the flu vaccine, they can just check in, get their vaccine and check out quickly rather than waiting for a longer time. So check with your healthcare provider in your local area, which is the best source for you to get the COVID, for you to get the flu vaccine. And also there are many guidelines that everyone is following, our clinic and other clinics, like in terms of avoiding overcrowding in the waiting area. We try to space out the visits that more so that there are not many people waiting, and we have extended waiting areas in case there is overcrowding or so many patients are there at the same time, we can separate them out. So that should not prevent you from getting your child vaccinated against flu. Thank you everyone for providing all the resources and information. I'll be here again as well to answer any of your questions if you might have. But yes, again, one more time, as a pediatrician, me and my team, everyone, we strongly recommend that you take your child, to your healthcare provider or whatever the local resources you might have available, but get them vaccinated for the flu, so at least you can protect them from influenza and maybe prevent other respiratory complication if they were to catch other diseases. Thank you.
Great, thank you so much, Dr. Vanagaria. So I would like to thank all of the panelists for sharing such great information today. So we do have a few minutes for some questions, if you have any questions. So you can share your questions in the question box. Okay. Let's give it a few more minutes. Okay. So I just have a question for, let's see, for Iris. Does Horizon Blue Cross Blue Shield, I think you probably answered this, offer insurance for those who are uninsured and underinsured?
So that's a great question. For individuals who, I would always first start with trying to apply to NJ Family Care. There are eligibility guidelines that you have to comply with in order to be eligible for Medicaid coverage. For those folks who don't qualify for Medicaid, there are alternative coverage under the Affordable Care Act or Obamacare. There are additional options for folks that don't necessarily qualify for Medicaid, but still need some type of coverage that's cost effective. For individuals that that are not eligible under Medicaid or the Affordable Care Act, either because of status, or other extenuating reasons, I always encourage folks to connect with their local federally the FQHC, federally health qualified centers, to get their medical needs met. And their model are very comprehensive as a complete medical home, where they can access a PCP or primary care physician and all the other specialties, right? Pediatrics, women's health, and any other like dental, nephrologists, behavioral health, etc. So for folks that don't necessarily qualify for Medicaid or don't necessarily get coverage through their employee-based coverage, or are eligible for the Affordable Care Act, I would refer them to their local health center or FQHC.
Okay, that's really good. And so does Horizon Blue Cross Blue Shield have a brochure of the list of local FQHCs in the area?
Yes, we do. That information can be found on the Department of Health of New Jersey website, but I'm happy to share the link with a list of all FQHCs across the 21 counties.
Okay, that would be great. Thank you, Iris. And I know we're pressed for time, so I have one more question here. From Michael, when will your Walgreens location start administering the flu vaccine? Can someone who doesn't have insurance pay out of pocket for the flu vaccine?
Hi, can you guys hear me okay? My laptop died, so I had to switch over to the phone. Is that working?
Yes.
All right, great. So yes, absolutely. We start administering the flu vaccine, honestly, as soon as the inventory starts to arrive in the stores. I think the majority of us did start receiving the shots about last week. I know I've already given one just this week as well. So as early as it comes, we do start administering it if patients are looking forward to that. And same thing, yes, we do have, we can have a cash paying patient. I believe the quadrivalent regular flu shot is about $40.99. But, we try our best. There are some vouchers available from certain Walgreens that are doing some type of clinics with the Department of Health that are giving them at no charge. So the best thing I would say is if there is no insurance, just let the pharmacist know. Again, we're going to do our best to try and find some resources to get these patients vaccinated at as low a cost as possible.
Okay, that's really good to know, especially. Go ahead, Mom.
Yeah, I was just going to jump in and say too, if someone doesn't have insurance, they could go to the Newark Department of Health, which Velda oversees, for childhood vaccines. That's the Vaccines for Children program, and also for adults 19 and over that are uninsured, or underinsured. So there are definitely resources in Newark and the surrounding communities, as well as throughout New Jersey, for people who don't have insurance right now, to go get a flu vaccine.
Okay, great. Thank you so much, Emily. So I know it's 1 o'clock, and it's about that time. So I just want to, thank everyone who joined the webinar today. I also want to thank the panelists for all of the wonderful information that they provided, the resources. As we know, the flu season is approaching, and all of the information that they provided, it's extremely helpful. This webinar is recorded, and the resources that were shared. I do encourage you to please share this information with your colleagues, as well as your family, because we're already dealing with COVID. So we want to make sure that we take control of our health and make sure that you all get vaccinated. If you have any questions, my information is on the fly. If you know me personally, you could always reach out to me. But thank you so much. Thank you again. And I thank all of the panelists for taking part and sharing such great information. This information was extremely helpful, and we definitely needed it. So thank you again. And one more thing, there is a survey that will be sent to your email. So at your earliest convenience, can you please complete that survey? Your information, your feedback is extremely important. So thank you again.
Thank you.